Hi, my name is Jameson Floyd, and I'm a Postbac Fellow in the NHGRI's Health Disparities Unit within the Social and Behavioral Research Branch. Bouncing back, recovering, getting back on your feet. This ability is a well-known quality called resilience, and I think it's safe to say that we've all had our resilience tested in some way, shape, or form over the course of the past year. All of us have had to deal with the effects of something we've never seen before in our lifetime, a global pandemic. Those living with chronic diseases like sickle cell disease have had to manage their care in addition to the added stressors the pandemic brings. People with sickle cell disease have a genetic mutation in their beta globin gene that ultimately results in their red blood cells being abnormally shaped. This mutation can result in a number of symptoms such as fatigue, pain, leg ulcers, and infection. Roughly 100,000 people in the United States have sickle cell, with majority of them being African American and Hispanic American. Our group is interested in how the COVID-19 pandemic has impacted the resilience of individuals living with sickle cell disease. Our group administered a COVID survey open to a cohort of adults living with sickle cell disease to measure the impact COVID had on a number of social measures, such as resilience. We used a measure called the Brief Resilience Scale to determine any changes in resilience. When we compared resilience data in our cohort from before the pandemic to during the pandemic, we found that resilience had significantly decreased. While this may seem intuitive given the pandemic, this is an important finding given a greater understanding of the experiences of those living with sickle cell disease. Managing chronic pain that can result in debilitating pain crises, on top of potential bias in the healthcare system due to the racialization of the disease, can prove to be very challenging for those living with sickle cell. Now, with added anxiety, stress, and uncertainty that has come with the pandemic, we are witnessing a resilient group of people take a significant hit to their ability to bounce back. Researchers have a unique opportunity to continue investigating the effect resilience has on the physical and mental health of adults living with sickle cell disease. While the relationship between resilience and physical health is still being uncovered, there is an abundance of evidence in the literature that shows resilience can and does have an impact on an individual's mental health. Studies on resilience have shown that promoting resilience can prevent mental disorders like anxiety and depression, while also soothing feelings of worry and hopelessness. Further studies on resilience in the sickle cell disease community can help healthcare providers, researchers, and patients alike develop meaningful interventions that will hopefully lead to more promising clinical outcomes and better lives. Thanks for listening.